So for this video, we're going to talk about thyroid disorders. When you think of thyroid, think of everything metabolism because your thyroid deals with everything metabolism. So you have hyperthyroidism and you have hypothyroidism. So with hyperthyroidism, you have what's called Graves' disease, and that is too much thyroid hormone. So they're going to have a increased metabolism. So you're going to see bulging of the eyes. They have the inability to concentrate. They're jittery. They may have insomnia, heart palpitations, an increased blood pressure and an increased temperature, weight loss and diarrhea because things are moving fast in their system. So for the diagnostics, it's confirmed by a low TSH. They check the T3 and T4 levels, and they also do a radioactive iodine uptake scans. And for nurses who are pregnant, they cannot be around that, and they also can't see patients for up to a couple of days after they've had this radioactive iodine. So for your medical treatment, radioactive iodine to destroy the thyroid tissue. They can check the T3 and T4 levels, the medical prescriptions, so methimazole and PTU are the drugs used for that. And the goal is to return the patient to a normal thyroid level, which is called euthyroid. Your nursing interventions, so they're gonna have a diet high in protein. You wanna increase vitamins, especially vitamin C and D. You want to monitor for hypocalcemia, so low levels of calcium. And you can check that through the Trousseau and Diagnostics. And then also you want to monitor for a thyroid storm, which can lead to heart failure. Your pre-op nursing interventions. So the patients who decide they're going to receive the radiation or the removal of their thyroid. So you want to support the head while turning in bed or rising to a sitting or standing position. You want to do voice checks every 2 to 4 hours. And for post-op, you want to keep the patient in semi-Fowlers. You want to have a suction and trach tray available for emergency use. You want to check bleeding sites at the back of the neck, so in case there's a pooling of blood from the gravity of blood flowing back. And you want to also check for tetany, which are muscle spasms. So now let's talk about hypothyroidism. So these are myxedemia, which is in adults, and cretinism, which is for children. And this is not enough thyroid. So their metabolism is going to be slowed down. Things are going slow in their body. So they're going to have a decreased BP, a decreased temperature. They're going to have some weight gain, constipation, impaired memory, maybe some thinning of the hair, weakness, abdominal distension, and menorrhagia, which is excessive menstrual cycles. Diagnostics, they check the T3 and T4 levels, and their medications are levothyroxine, which you give on an empty stomach, and they're going to be having some lifetime hormone treatment replacement. Your nursing interventions, you want to keep the room at 70 to 74 degrees because they get really cold easily. You want to monitor their bowel movements for signs of constipation. They're going to be on a high protein, high fiber, low calorie diet since they're prone to weight gain. You want them to have regular checkups to adjust their drug dosage periodically. So since they're on lifetime treatment, you want to keep monitoring them to see if they need to adjust, maybe increase their dose or decrease the dose. They need adequate intake of iodine, and you can get that from sources such as saltwater fish, milk, or eggs. And you want to also increase fluids. So that is your hyperthyroidism and your hypothyroidism. Remember, the thyroid's dealing with everything metabolism. So in hyper, that means it's going up. Things are speeding up. They're getting hot. They need some methimazole for their medications. You want to make sure your pre and your post-op, you want to make sure that you're supporting their head, Make sure they're in semi-Fowlers when they come out. Make sure you're checking for any pooling of blood in the back of their neck or their head. You want to have that suction and trach kit ready. Hypo, things are slowing down. Their BP is going to be down. They're going to have constipation. They're going to be cold. You're going to give them levothyroxine. Make sure they're on a low-calorie diet because they're prone to gaining weight. And then they need their medication dosage checked to make sure that they're still at the therapeutic levels. So again, that's hyperthyroidism and hypothyroidism, Graves' disease and your myasthenia disease.